Patients come to us with so much hope, hoping for a miracle sometimes. It's important for us to make sure the patient understands that we're going to bring every expertise that the hospital has to offer to bear upon their situation and give them reassurance that anything that could be done in the medical field will be available to them. But most importantly, letting them know that we care and that we are going to be with them and we will take care of them no matter what happens. My role is primarily taking care of patients with gastrointestinal cancer. I treat with radiation by working in the context of a multidisciplinary care team to best take care of patients with complex GI cancers. I also do clinical trials-based research as well as biomarker-based research. One of the most memorable moments, and what was a real teaching moment for me, happened very early in my career, is that we should never say never. It's important for us to look at the patient in front of us and offer our patients the best shot for the best case scenario. Scans are fine. We're clear. 5 years post-Whipple, scans are clear.
We talked about this at the very beginning. 5 years is great, but we want 10, we want 15, we want more.
Just this week, I met with a patient who's treated on one of our neoadjuvant pancreatic cancer trials. And I'll never forget when she came to us from St. Louis and was terrified. Meeting with her 5 years later, knowing that she's beaten this cancer and is enjoying a great quality of life. There is no feeling in the world that can replace that satisfaction and the bond that we develop with our patients during this journey, not just through treatment, but through the survivorship period, is really the greatest feeling in the world. The most rewarding thing about being in a center like the Mass General Cancer Center is knowing that we're all in this to take care of patients. The reality is that everybody at the Mass General Cancer Center could be doing anything. I work with some really smart, talented people who could be in any other field, and instead, all of us have chosen to work in a field where we're taking care of patients with very difficult cancers, patients who can get very sick. Things lined up perfectly though, so I was thrilled with how everything went. So we're going to be right on target, and hopefully we'll only get quicker as we do these, okay? All right, take care. What we're trying to do is bring that exact same great quality care, that expert disease-specific care, the great clinical trial options that we have here downtown, out to Newton Wellesley Hospital and offer the exact same care. I grew up in Connecticut. I grew up playing hockey, which is my main hobby. What I love the most about hockey is the teamwork and the competitiveness. Like everybody else, I love winning. I love having an outlet for my competitive juices, but I love that it's a team sport, and I love that someone can make a mistake and you have a teammate there to pick you up. I love that hockey is most beautiful when players are passing it to each other and it looks like tic-tac-toe out there. The individual play doesn't interest me as much as the really beautiful team play. We at Mass General, and particularly I think in the GI cancer group, are interested in paradigm changes. We're not looking for the small incremental gains. We're really here to make a difference, and we're here to change the way that we think about cancer and the way that cancer is treated. My name is Ted Hong, and I'm a radiation oncologist at Massachusetts General Hospital Cancer Center.